The last thing that we're going to talk about in terms of cerebral hemispheres is the arterial supply. The basic concept is that the arterial supply of the cerebral hemispheres is derived from two main systems. It's derived from the internal carotid artery system and also the vertebro-basilar system. The anastomosis established between these two arterial systems is what creates the circle of Willis. So we'll there's a nice highlighting there. We'll move on and talk about each of these arteries in isolation. We'll start off with the internal carotid artery system. So the internal carotid artery enters the skull through the carotid canal. It has a oblique course through the bone and emerges into the cranial cavity in the vicinity of the foramen lacerum, if you remember your skull anatomy. It then travels in the cavernous sinus immediately adjacent to the body of the sphenoid. It emerges from the cavernous sinus medial to the anterior clinoid process, but lateral to the optic nerve. The artery then curves back to lie on the roof of the cavernous sinus for a little bit before passing directly upwards to reach the anterior perforated substance, which it does here. At the anterior perforated substance, it divides into its terminal branches. It divides into the middle cerebral artery, then the anterior cerebral artery, and also connects to the posterior cerebral artery via the posterior communicating artery. The anterior, if we turn our attention to the anterior cerebral artery now, we'll note that it passes above the optic nerve. So it passes above the optic nerve and then reaches the dorsal surface of the corpus callosum. As it does so, it gives off an anterior communicating artery which connects and completes the arterial arch, known as the circle of Willis. So if we follow the circle of Willis around, we'll see that it's formed by the anterior cerebral artery, the internal carotid artery, the posterior communicating artery, and then at the front it's completed by the anterior communicating artery. I might have said that already. Doesn't matter. Anyway, if we now look at each of the branches of the internal carotid artery separately, we'll be able to get a bit more of an idea of the arterial supply of the brain. So, firstly, we've got the anterior cerebral arteries, and they, once again, to revise, they pass over the top of the optic nerves, which lie here, and then reach the dorsal surface of the corpus callosum, where they lie in the interhemispheric fissure. They supply branches to the medial surface of, so that's the corpus callosum there, they supply branches to the medial surface of the frontal and parietal lobes all the way back to the parietal occipital sulcus. It also, the artery also supplies the internal capsule through branches, through an important recurrent branch. The arrow's a bit off, but the recurrent branch is this branch, and it supplies the internal capsule. The functional significance of all these areas supplied will be discussed at the end of this talk. We'll move now to the middle cerebral artery, and we'll note that the position of the middle cerebral artery is deep within the lateral sulcus, or sylvian fissure. The branches of the middle cerebral artery expand, they pass out from the lateral sulcus and onto the surface of the lateral surface of the cerebral hemispheres, and that's what they supply, the lateral surface of the cerebral hemispheres mainly. However, there is also a number of small branches which pass to the internal capsule and deep structures, and these are known as the striate arteries here, and they're the series of arteries which pass through the anterior perforated substance. That's basically the internal carotid system, and now we'll examine the vertebro-basilar system instead. The basic thing to remember is that two vertebral arteries come through the foramen magnum and join to form the basilar artery at the lower border of the pons. They end above by dividing into the posterior cerebral arteries. The posterior cerebral arteries are connected to the internal carotid system by the posterior communicating artery, and they lie basically along the medial surface of the temporal lobe. They supply the medial surface of the temporal lobe as well as the medial surface of the occipital lobe. And that's the only artery that's concerned from the vertebro-basilar system that supplies the cerebral hemispheres. But while we're here, we might as well talk about the other branches as well. The other branch of the superior end of the basilar artery is the superior cerebellar artery. In between the superior cerebellar and posterior cerebral arteries, we have an important cranial nerve, and that's oculomotor nerve, or cranial nerve 3. And this nerve can be affected by aneurysms in either of the posterior cerebral or the superior cerebellar arteries, and you can see why now. The basilar artery also gives a number of branches to the ventral surface of the pons, and also gives a large branch called the anterior inferior cerebellar artery to the undersurface of the cerebellum. The vertebral artery gives off the posterior inferior cerebellar artery also for the inferior surface of the cerebellum. And that's it in terms of the arteries, but we should overview the vascular territories of the brain and also the functional deficits created by occlusion of these arteries. Firstly, we'll start with the middle cerebral artery, and remember how we said it supplied the lateral surface of the hemisphere. This covers the primary motor area for the face and upper limb, as well as the primary sensory area for the face and upper limb as well. The anterior speech area and the posterior speech area may also be affected by lesions to the middle cerebral artery. However, the thing to note though is you often get a complete hemiplegia or paralysis or complete hemianesthesia from middle cerebral artery lesions, and you may ask why, if it's only affecting the primary motor and primary if it's only supplying the primary motor and primary sensory areas for the face and upper limb. And the reason why is because if you remember those little striate arteries, they supply the internal capsule, and if you infarct the internal capsule, you cut off the entire contralateral motor innervation, and that's why you get a complete hemiplegia. So sometimes it confuses the picture a little bit, and you don't get a clear-cut middle cerebral artery syndrome. Moving on to the anterior cerebral artery now. The main functional areas, the main area that it supplies is the medial surface of the frontal and parietal lobes, and in doing this it supplies the leg and perineal areas of the motor and sensory cortex. Once again, often lesions of the anterior cerebral artery produce a complete hemiplegia and hemianesthesia, and not just affecting the leg and perineum. And the reason for this is once again the recurrent artery. And the recurrent artery once again supplies the internal capsule. So if you affect the artery before the recurrent artery, you get a complete hemiplegia pattern. If you affect the artery after the recurrent artery comes off it, then you only get a leg and perineal paralysis / anesthesia. Which is what they typically talk about with a anterior cerebral artery syndrome. So it is a bit confusing. You have to remember that there are arteries which supply the internal capsule, and the effects of these complicate the picture somewhat. However, we'll just finish off now and talk about the posterior cerebral artery. It supplies the medial surface of the occipital and temporal lobes. The major functional area here that is supplied is the visual cortex. However, the occipital pole is somewhat spared by the middle cerebral artery creeping around from the lateral surface of the hemisphere, and that's the fact that the middle cerebral artery creeps around and supplies the occipital pole means that the macular area is sometimes spared of vascular damage or an ischemia, which means you get a phenomenon called macular sparing. So that's what they're talking about. It's the fact macular or central area of the vision is spared by the middle cerebral artery, and that's it in terms of vascular supply of the cerebral hemisphere. Remember, you must remember the vascular supplies of the cerebral hemispheres. It is one of the most important areas in neuroanatomy and in managing stroke patients, so it is one of the major important topics that you should learn. And that's it, folks.